Welcome to the Community Foundation of the South Okanagan's second podcast. Today we're really excited to talk about the Canadian Alcohol Use Disorder Society, an organization that we're proud to partner with to try to deal with some of the issues around treating alcohol use disorder in our society. I'm really glad to be with Heather Allen today from CODS. I'm going to say CODS from now on because it's too hard to say the whole name. So CODS is a 3-year-old organization that the foundation is partnered with. And we're excited to hear more about what CODS is doing in the community and what you're trying to accomplish. So thanks for joining us today.
Great. Thanks very much for having me.
Can you start by giving us a bit of a background about CODS and what the mission of CODS is?
For sure. So I'm not sure if you mentioned it, but the full name is the Canadian Alcohol Use Disorder Society. And the interesting part about that is that we are talking about alcohol use disorder, which many people probably think of or know of as alcoholism.
Yep.
And the reason that we are talking about it as alcohol use disorder is because we're trying to get people to understand this as a medical condition. And then once you understand that, then you know there are treatment options. So that is like the base core foundation of how and why we started. So we can talk a bit about the person who was really the founder of our society.
Yeah, let's do that.
Yeah. So Dr. Jeff Harries, he was from Penticton. I'm sure lots of people here know him. He was this fantastic visionary who had been treating alcohol use disorder for a long time in his practice and having great success for people, really finding different medications that would take away people's cravings for alcohol, meaning then once they had that under control, they could then seek counseling and really have their brain heal and fully recover from alcoholism. And so Jeff was doing this here in Penticton. He was just anybody who would listen, he would tell them about this. And then he got invited to a provincial conference. And there he gave his presentation about his treatments. And then he had this like aha moment. He looked around the room and it was all healthcare providers. And he realized this information that he thought was known by everybody was really not known. And so then for him, that was his impetus to just go full speed ahead and try and bring more awareness to this issue.
So you said two things there that I think are worth highlighting. The first is this is a medical condition. So I grew up thinking this was a moral failing, but this was someone needing to just get a handle on their booze or
pull up their socks,
something like a hit rock bottom, all those kinds of things. But you're saying something totally different.
That's right. So if you understand alcohol use disorder as a medical condition where for some people, alcohol affects their brain function in a different and stronger way than it does for other people, it really starts to actually change their brain chemistry and actual structure so that they have compulsion to drink, they crave, and even if they begin to lack control, even if that means destroying family connections and all that kind of thing, it's not a decision or a choice that they've made that I want to be with my family, but I want to drink more. It doesn't work that way. It's a medical condition. And so then when you understand that, then you have more compassion, right?
Yes,
just like you would for someone if you saw them on the street and they were looking a bit woozy and you knew they were a diabetic. You knew that their insulin balance was out of balance.
Right.
And you're not like, pull up your socks.
Yeah, quit being lazy, man.
Exactly. Yeah. Maybe would you like an orange juice? Right?
Right. Actually, yeah, that's a really incredible shift mentally for probably all of society, I would think, but we'll get into that. The other thing that I thought was interesting about what you just said is that Dr. Harries is speaking to health professionals and none of them know. How is this possible?
I know, it seems incredible, doesn't it? But there are several reasons. The first one is that, like you said, entrenched belief of what alcoholism is, long-standing in society, thousands of years of way of thinking about alcohol. And that's everybody, right? That's cross sectors.
Doctors are people too, right?
Doctors are people too. And in the medical system, so if you're not taught the new treatment options and that alcohol use disorder is a medical condition, then you're not going to be going out and doing that in your practice. And second reason is that these medications are not what are called off-label.
Okay.
And so that means that when they were developed by the pharmaceutical companies, they were researched for a different purpose. And when that's the case, not only can the pharmaceutical companies not advertise for this new purpose unless they've gone back and done really expensive research.
So they cannot advertise these medications.
No, they are legally not, they legally cannot and have faced big fines. So whereas with other medications, you have pharmaceutical companies, pharmaceutical reps, you have that whole marketing campaign that can happen.
Right.
Advertisements, which can't happen for
Okay,
most of these medications.
so how many medications are there that we can use for treating this?
So in Canada, there are 4 that are recommended in the prescribing guidelines, and then there's emerging evidence for a number of other medications.
Okay.
Yeah.
And how long have scientists or the medical community as a whole known that these medications can help?
Well, the medical community, in many ways or in many places, still don't know.
Right.
But and for the very reasons that we were just talking about, which is also to be compassionate about that. Like, it's also not anybody's fault, right?
Yeah.
It's that they're not getting this knowledge yet. And then, but sorry, tell me your question again.
Yeah, in terms of the medications, like how scientifically, how long have we known?
Oh yeah, but in the research community, and often there's that 15 to 20-year leg anyway in research into practice. But in the research community, it's been for decades.
Right.
Yeah, not for all of them, but for some of these medications.
So it's not like we need to raise money to do research to prove that this works.
No, although there is ongoing research about more effective other medications and that kind of thing. There's always research going on, but no. And another issue is there was a medication in the early part of the 20th century where if you drank, it made you sick.
Right.
And so this is obviously not recommended now.
Right.
But once information is out in the community, it can sometimes be hard to pull that back in.
So that's what people are thinking about when you say medication. It's almost like some kind of evil punishment for having the moral weakness to go drink somehow. Now you're going to get even more sick than you would have been otherwise.
Exactly. It's not a compassionate approach, which is what we aspire to.
Okay, so to summarize, alcohol use disorder is a medical condition. There are right now 4 approved medications in Canada for treatment of this. The research is done in terms of knowing that these things work.
Yeah.
But the medical profession doesn't yet know as much as it should, like the physicians, the prescribing physicians, and so on. The community, I would say, also doesn't know.
No.
Would you agree with that?
Yes, absolutely. Yeah, so I mean, our work is really to get the message out there, but it's not just as simple as telling someone that this is true. People that have access to different information, and we were talking about entrenched beliefs. For me, like almost everything you read, movies you watch, they have a different perspective on what alcohol use disorder is, right? Like one example is like Mark Anthony, 2,000 years ago. I was just reading about him and how he was seen as like a failed governor for Julius Caesar. And he actually was blamed for this because he drank so much wine. And he actually wrote a book, which has been lost, but it's called On My Drunkenness. And it's about how he is kind of a moral failure. Yeah.
Because he drank too much.
Yeah. And so you start there and we think about it. And you can't blame people for information they don't know or science they didn't have. Right through to today. If people don't have that information, you can't blame people. So
we need compassion all around.
Compassion all around, exactly.
Yeah, and and one of the things I think about with this as well is that when you, this is a very personal thing for many people who have had to cope with the consequences either for themselves or a family member or whatever. And so you develop a story for how to cope with that trauma. And now CODS is suggesting a different story.
Yeah.
That would be a threat. It could be seen as a threat, like maybe not consciously, but certainly subconsciously. It would be perhaps hard to shift that thinking, wouldn't it?
Well, because you're not just thinking ahead to people who could benefit from this treatment and trying to help them see that. You're also looking back at people who could have also benefited from it. So there's a sense of grief and loss with that. But there's also the kind of re-examination about how you might have thought about that person, about the actions they did, guilt, and all those kind of
How
things.
you handled
how
their
you
issues,
handled
yeah,
it, what you thought about it. So, yeah, like you have to be. It's something that Jeff used to do in his presentations, was just kind of pause. And same for the medical community. Like, you probably had people you wished you could had treated differently.
Right.
And same just in everyday life.
Right.
Yeah.
Yeah. So this is pretty complicated. So,
Not to mention that it's just about all of us. We know someone who has been impacted or has impacted us, right?
Right.
Yeah.
So what are the stats in Canada for people suffering from AUD?
Well, Stats Canada it's roughly 1 in 5, which I think if we 30 million population, so
Yeah.
that makes like 6 million people who are affected by alcohol use disorder.
Right.
And maybe
now that's directly affected, like they
directly
suffer
affected.
from AUD?
Yeah.
Wow.
Yeah. And I mean, I would think just about everybody is indirectly impacted.
Well, I can tell you, since we started collaborating with CODS, and I've spoken with dozens and dozens of people, not a single person that I've spoken with does not have knowledge of someone close to them that is either suffering or has suffered with AUD.
Yeah.
Like not a single person. So I would be very shocked if someone has managed to go through their whole life without a friend or family member or themselves
Yeah.
suffering from that.
Yeah. Especially like in Canada for sure, where I think I was just reading an anthropological paper really talking about the culture of alcoholism in our country.
In Canada specifically?
In Canada, in Commonwealth countries.
Right.
Yeah.
Yeah.
And you look at it like even it relates to a lot of things. Indigenous peoples.
Yeah.
Right? How alcohol was used as a colonizing tool.
Yeah.
And then also used as a coping mechanism for dealing with the colonization.
Yeah.
It's embedded and threaded deeply through all of our society.
For sure, yeah.
Mm-hmm.
So what happens, like, let's say someone is aware that they can get medication.
Yeah.
And they go to their
gotten over the mindset
yeah,
shift
and they
and
managed to get
disbelief.
all of that stuff.
Yeah.
Yeah. And they managed to find a doctor who happens to know
Yes.
about the medications, which is another challenge, obviously, that
Yeah.
CODS is trying to solve. And they get to the point where they're prescribed medication. Like, what should they expect? What is a normal treatment path for someone?
Well, that's a really good question, because I think if you back up, the treatment path starts with recognizing that you might be concerned about alcohol use disorder. And maybe we should even say what alcohol use disorder is.
Like specifically defined as, right?
Specifically defined as, in lay language, you can use the 4 C's. It's cravings that you can't control,
right,
no matter what the consequences are, and you just have a compulsion to drink. So you would so if this is something you recognize or you wanted to talk about someone else, you would go to your family care provider, so your doctor or nurse practitioner, and they would first do what is a screening. They would just ask you some different questions to figure out, is it mild, is it moderate, is it severe, what kind of, and then they would ask you, what are your goals? Like, would you like to stop drinking altogether? Or are you interested in just reducing how much you drink? Because this is a possibility and it will affect the medication that is chosen for them. So then together they figure that out, and then they would be, a medication would be selected that seems to be appropriate for that person. And then that would be trialed. And of course there would be follow-up and management of symptoms if there are some side effects, which there can be, just like with any medication. And then the important piece is that this really complements other programs. So it means if you can get your cravings under control, then you have the stability to show up for your counseling.
right.
You have the stability to reconnect with your family or with your culture or with traditional healing practices,
right,
or whatever that might be that's right for the individual.
So it's not like you take a pill, you're done.
No.
It's like there's more to it. Yeah,
No.
for sure. I mean, most people suffering from AUD, I would assume, have either prior to their AUD or during, certainly have experienced some kind of trauma, which probably should receive support from counselors and other support workers, I would think, right?
Yeah,
Yeah.
and that can be true. There can be trauma that led to that, or there can be trauma that was inflicted because of alcohol.
Yeah.
But for some people, it's not. Like
Right.
for some people, we've talked to people who were retired and just had,
Bored.
yeah, just started drinking too much, and
Yeah.
then suddenly it was out of control, and they just needed to get it back in control. And the rest of their connections and family, there were some things to work on with their family, but they didn't need all of the others.
Right. So everyone's different.
Yeah.
But I think that it sounds like the universal thing here, obviously, is that the struggle to change, it is much worse when you can't control the physiological response.
Yeah, that's right.
And it's not like you can will that response to go away necessarily.
Yeah,
Although technically it can be done by a small portion of the population.
it can.
Just like some
But
people
that's
can
like
run
white
tri-
knuckling,
Right.
right?
White knuckling, exactly.
And
Yeah.
if
Yeah.
you don't have to white knuckle or always be worried that you're going to fall off the wagon or whatever, then it's a lot more helpful. And it actually, there is our scientific officer at our organization be able to explain it better. But the brain really does heal. And so,
So it's not just the cravings are gone, you're actually healing the neural pathways or whatever in your brain as
Correct.
you take
Yeah.
as you take the medications. Is that the
that's what the medications
Right.
do. So they would, um,
we're not doctors.
yeah, we're not doctors, but different chemical transmitters like
Yeah.
dopamine or something, the levels are affected if there's alcohol constantly present in the
Right.
brain, and then the receptors are blocked, and then what will happen is the medication will act in a way that will make it so that your levels are back again.
Rebalance
So,
everything.
rebalancing.
Yeah.
Yeah.
Interesting.
Yeah,
Okay.
because your brain always wants to be in a balanced state or in homeostasis. Right?
Yeah.
So,
Yeah.
Yeah.
Okay.
so that's why people get so addicted, right? Because your brain is trying to get balance.
Right.
So if you're out of balance because you've got alcohol in your brain,
Right.
it does everything it can to get to that balanced state,
Right.
which means people need to drink if that's how your brain's been rewired.
I mean, I've never, I'm very blessed to not have had a physical addiction in my life of any kind, but I've spoken with many people that have, and I've heard them say it's like deciding not to breathe. It would be the same as deciding
Right.
not to drink. Like you just can't.
Right. That's a
You just
really
can't
good,
do it. And
really good analogy. Yeah.
So,
Yeah.
so the compassion is really important,
Yeah.
and the ability to provide a medical support.
Yeah. And then back to your thing about it's not just take a pill and you're done. That is kind of, there's a biopsychosocial model.
Yeah.
And so the psycho and social is connections to culture, your family, the counseling, your psychological well-being. Those have been really well taken care of with peer support programs and those kind of things. But when the bio part, you're just relying on white knuckling, it
Right.
doesn't make the other pieces work as well. But if you're having support that's taking away those cravings, then suddenly the pieces come together.
Yeah, it makes sense. So you start taking the medication. Is it addictive? How long do you need to take it? Does it last forever? Like, how does that work?
Yeah, so there are different medications, and we are getting into like medical territory.
Generally speaking.
Generally speaking, not a clinician,
Yeah.
but I'm familiar with this material. Usually only have to take these medications temporarily.
Okay.
Yeah. Some say for 3-6 months, something like that, but it's not a forever thing. And as far as addictive qualities, the ones that are in the guidelines, which are currently put out by the BC Centre on Substance Use, and they're leading the nation basically in prescribing guidelines for Canada. So we're lucky to be in this province.
Mm-hmm.
But the ones that they recommend are not going to be addictive. Yeah.
Okay, and they're short-term medications. Are they expensive?
The prescribing fees just changed, so no.
No. Okay. Yeah. Probably not as expensive, regardless, as it would be to maintain an addiction to alcohol or other substances.
Well, that's very true.
Right.
That's very true.
Yeah. Okay. Well, that's so. So you said that roughly 1 in 5 people, or around 6 million Canadians, suffer directly. Just about everybody suffers indirectly, likely, anecdotally, anyways. Right?
Yeah.
So, what do we have a sense of the success rate? How well people respond to these medications? And again, generally speaking.
Well, speaking from Jeff's experience, the founder that we talked about at the beginning, he found that it wasn't always the first medication that you tried. Sometimes you have to try another one, or you might have to try combination. You might try dosing differences. This is all the information that clinicians are learning. But he found that just about everyone could fully recover within his own
Within
practice.
his practice, just about everybody.
Yeah.
Wow.
Yeah.
Okay, that's
Yeah.
remarkable.
Yeah, and some of them take a week or something. They have different
A
times
week?
where they work. Where they work.
1 week, you said? Some of them take a week to start working?
Yeah, but we have anecdotal stories of people speaking to us. Took it in the morning, that night. He had half a beer and he didn't want it anymore.
That's insane.
Yeah, and to manage expectations, that's not for everybody, but because people are all different and we react to different things differently. But yeah.
So when you tell people that, do you find that it's almost too good to be true? Do people respond that way and say this can't be possible?
Yeah. Yep. That's definitely we're still learning how to talk about this in a way that people will be receptive to the information. We're finding it's actually just conversations. You need to have the back and forth, have questions.
Right.
Because I was skeptical. Lori, our board chair, she was a ER nurse and met Jeff and he told her about this and she was skeptical. I don't see really that it's wrong to be skeptical about something like that. Like, why wouldn't everyone know about this?
Right.
Yeah.
Interesting.
Mm-hmm.
It's such a weird thing because like I have a number of friends who are physicians who I've told about this and they've known Jeff and they know his work and one of them said to me one time, "Why are you spending all that time on that anyways?" And I'm like, how can this be a mental block still, but it is. People have preconceived notions and they've been trained a certain way, like socially trained and clinically trained in certain ways, and it's hard to change. And then another physician I spoke with recently, he made a really important comment to me that helped me understand the resistance. And he said, if someone came to him and said, I heard of this doctor, saw one place that's treating someone in a certain way, and there's one guy doing it out of hundreds of thousands of physicians, you'd want your doctor to be pretty cautious about experimenting on you in that way. So the doctors approach these things with caution, which makes sense. And at the same time, 6 million people are suffering.
Yeah, and that's why it's going to take time. And that's why the development of prescribing guidelines with national ones coming out with organizations like ours, spreading the message and having really evidence-based information out there for people to look at, for clinicians to look at, because I don't want to be the patient of that doctor who, is a maverick or something. It's their job to be careful and safe and and use effective treatments. But the research shows that this is, and it's just a matter of time to helping people feel confident prescribing. Right. And actually that brings up to one. So we work in a number of areas. We're trying to help the general population know about this. We're trying to help clinicians know about this. And then we're working with the research communities to get the information that they've been working on out there. But we're really excited about a medication selection tool that we've created, because it's like, I don't know, if you know how to fly a plane, you know that flying a plane is a good idea. Right. You need to have some mentoring and some guidance and some training to actually just get in the cockpit and fly it, right? Yeah. So that's what this tool is trying to take. The guidelines says all the reasons, everything we've been saying, why you should do this. Here's how to do it and feel confident about it.
Well, and you said earlier that often there's a need to try different combinations or different dosages and different schedules. I don't have the right words for it, but different medications even sometimes, I assume, as well. So I relate that to, I have an infection, I need an antibiotic, and they try one and it doesn't work, so they try another one. Is it similar to that in a way?
Right, exactly.
Yeah,
Yeah.
but I guess we've been trying different antibiotics for ages now,
Yeah.
and to get comfortable doing that with AUD medications is different. Right?
And I would imagine that the research done on that product was for that purpose.
Right. So the pharmaceutical company has done a bunch of work to explain how to prescribe and all the things to look for and so on, right?
Yeah. Yeah. But that's all
Yeah.
coming for alcohol use disorder. It's just we all want it to happen tomorrow. We're working to shorten that knowledge translation, but it
Right.
still takes time.
Well, and so I want to just expand a little bit on the work that CODS is doing,
Sure.
specifically around that stuff. And I'll just start by giving a bit of a summary of the foundation's role in this, in that we are essentially acting as the backbone organization for CODS, look after all the administration, all the accounting, that kind of thing. So CODS can focus on its mission, and just not worry about the hassles of running a not-for-profit or a
Yeah.
charity, right?
Questionable whether we'd be sitting here today if we didn't have that support. So,
Well, I mean, it's a great partnership, and I think I know the reason we were interested is because we provide a lot of funding to a lot of crises in the community, probably most of which are exacerbated by AUD, whether it's poverty or joblessness or spousal abuse or child abuse or
mhm,
food insecurity. Like,
mhm.
just go through the list. I mean,
Yeah.
at some point, AUD is making it that worse for somebody. It's either put them in that situation or it's making them worse,
Mhm,
making that situation
mhm,
worse for them. So that's why we wanted to get involved,
mhm.
and do what we could. And our main job is funding and granting, but this requires more than that, more than we can just fund on a one-off basis. So our expertise on the admin side is a way of helping. But the point was to free you up to focus on your mission.
Right.
And so I want you to explain a bit more about the mission and a little bit of the detail of the challenge of getting some of these ideas through the healthcare system, because I know that I was blown away at the complexity of getting the word out. Like, it seems to me, it's just like shout from the rooftops and that's all you got to do. But that's not how it works in the
Right.
healthcare system. So
Right.
maybe a little bit of information about what you have to do there would be great.
Yeah. So, yeah, it's just like we already talked about that the risks involved in a healthcare system and the structures that are in place are there for a reason, right?
Yeah.
And so do have to go through the system and these things have to be trialed and researched and have effective evidence for them. So yeah, you can't just shout from the rooftops.
Yeah. And
And
then,
you need to have credibility as
yeah.
an organization. Yeah.
And also, one of the things that I found interesting, like, I don't know if surprising, I just never would have thought of it, but just interesting was, you can't just give them a flyer either. Like, there's a whole, like,
Oh yeah.
pathway or
Yeah.
whatever it's called that you got to go through in the system
Right,
to do
right,
these things.
exactly.
Yeah.
Yeah, because things like there's treatment pathways that need to be followed and you can't be losing things through the cracks and things. So there's that part of the education, which a lot of different organizations are not organized, like in interior health here is
Right.
working on that. They're doing a lot of great work. There's clinician education at Penticton Hospital in Kelowna and things. So things are really rolling there. So one area working with the Community Foundation is really building the community support around people so that someone who figures that they have a problem with alcohol, if they have more people in the community who think of it as a medical condition, are compassionate about it, and then they can think about different ways that they might be able to help people who are either employed by them or you know their family member or something, and then that helps for the person to go to seek treatment,
Yeah.
and they go with an understanding, which then helps the primary care provider who's trying to help them, because there's a lot of barriers along the way that will stop people from going to treatment. or once they get their prescription, maybe they don't fill it, right? So the more we can have people understanding in the community, that just really helps build it all together. So we're doing a lot of work with that, and that's where the Community Foundation really can help us too.
Yeah, we're excited to use our network of community foundations across the country. I think there's 206 or something community foundations across the country at this point. We're all independent organizations, but part of a national network that's really well connected. And just yesterday, actually, we hosted our first webinar with other foundations across the country. We had someone from Newfoundland and someone from Northwest Territories and BC and Alberta, and it was really great to start spreading the word about that. And everyone's excited about the possibilities. As funders in their communities, they instinctively, got what I got right away about the downstream kind of system change opportunity here to deal with some of these problems before they become a food insecurity issue. Deal with the mental health issue first, right?
Yeah, and it's something for community to kind of understand. Like, it sounds like this is an individual treatment in the healthcare system. What does that have to do with community? But Dr. Silvina Mima, who's our chief medical officer here, she said you can't rely on the healthcare sector alone. It has to have community support around the people that will help move this forward. And then the benefits of transforming an individual's life really does translate into transforming community.
Oh, for sure.
Yeah. We have one story, a woman, she was young. She had a child. She was living with her mom, and she just couldn't control her drinking. Her child was apprehended. Her mom kept trying to support her and help her, but eventually it just wasn't working. The grandmother had to choose between having custody of the child because they couldn't be in the same house as the mother. So the mother became homeless. Yeah. And so she lost her car. She lost her family, everything.
Yeah.
And then just through serendipity, talking to one of us, went and got treatment. A few months later, she has her son back for 4 days a week. She's renting an apartment. She has a car that works. She has a relationship with her mom. Right. And so if you think like that's individual transformation, which is amazing, but if you think about all those other things that were happening, and then also connecting back to culture as well.
Right.
So.
Well, and I mean, it gives me chills just thinking about that in terms of someone suffering from AUD causes a ripple effect of negative consequences for the people around them that care about them. And we've talked about that, but then the healing also causes a ripple effect. And you look at this young woman with her son. Imagine if he ended up in foster care for the rest of his life.
I know. And instead, I was interviewing her, and he was giggling in the back seat, and she was telling me, "Oh, I can take the shorter route home now because I can drive past the liquor store, and I don't have this compulsion, like where I literally can't understand it, but somehow I'm in the liquor store buying liquor." So instead, she has her own car. She has her kid in the back seat.
She has a place to live. She's not living on the street.
She's driving back home to her.
Wow, that's insane.
Yeah.
And so you very quietly said after a few months. So she took the medication for a short period of time and she felt better.
Yeah, but she did have all the other supports that were needed. And that's like to highlight that. She went to AA for the peer support.
Yeah.
Yeah. And she had a friend to connect and call because it's not like overnight for some people. Like she had to go through all of the things and be supported and get counseling. Yeah. All of those things. But just the chance of success for it is just so much better.
Yeah, that's incredible.
Which actually was another thing I should mention is sometimes there is relapse.
Okay.
And the medications will work again because that is one of the big barriers for people. They don't want to start. They've tried it before. They've failed. Every time you fail, it gets
worse. Yeah.
The physiological symptoms can be worse.
Yeah.
And it's a real barrier. Like,
and
I don't
you
even
feel
want to
worse. Like just as a human, you're like, you feel worse about yourself, right? Yeah. But so you can take the medication again. Yeah. And it will work again. Yeah. In theory, obviously. Yeah.
Well, in research.
And that's it almost sounds too good to be true.
Yeah.
Which is which I find, I know it's so exciting.
It is.
Yeah.
And, and it won't be everybody's story like
No,
that.
of course not.
I
Yeah.
interviewed another young man, and he really did. It took him a year of trying different. Unfortunately, he was Dr. Harris's patient,
Right.
and he tried a number of medications that weren't working. One of them was because he had early onset, and that's it. Like he was an alcoholic at 13,
Right.
and that can be a different medication. Had to trial certain things. Ended up a combination of things worked for him.
Right.
Yeah. Mm-hmm.
Right.
And he had a lot of work to do as far as with counseling and things like that as well.
Yeah.
Yeah.
So do you tell me a little bit, just even generally, about the societal costs? Like, we're talking about this ripple effect with this young mom and her son, and we can intuitively understand that cost benefit
Yeah.
at that family and that,
Well,
individual
you could see
level.
for her individual level, if she
Yeah.
was food insecure, she was homeless, like
Yeah.
this is costing
Exactly.
the city.
Yeah.
Yeah.
I mean, if she's homeless, she gets picked up by the police, or she ends up
Yeah.
in emergency.
I
Like,
know.
that's costing
I
money,
know.
and she's not getting better in that
No.
process. So,
Yeah.
so in terms of like across the country, what are the stats for the costs to our system, to our country from AUD?
Yeah. Huge. Almost $20 billion a year. And that's not just healthcare, but that's lumping in like lost productivity, cost to the judicial system.
Right.
Yeah.
$20 billion.
Yeah.
And how many people die per year from AUD?
I think it's almost 17,000 or maybe even more than 17,000 deaths attributed to alcohol use disorder. Yeah. And so there's work to do, of course. Part of this is screening for people.
Yeah.
When they come into the emergency department or they go to their primary care provider, that's one of the pieces of education that's going. It's really universal screening. This should be a routine screening for everybody. If those are the numbers of
Because
people.
we have this for other things, right? You have a diabetes screening, you have,
Yeah, exactly.
Yeah.
And it can manifest like if you have trouble sleeping or
Right.
you're depressed. Those can actually be symptoms of alcohol use.
Right.
Right. And if this is so prevalent in our society, it makes sense to always just be routinely asking that question of people.
Right. Yeah.
Mm-hmm.
Just like the other ones, they always ask when you go see your physician, right?
Yeah.
Yeah.
Yeah. Exactly.
That makes sense. Yeah.
Yeah.
Well, I mean, it's hard to imagine the benefits to society as a whole, let alone the individual, when you look at $20 billion in costs. And if you reduce that if you help, half the people, that's
I know.
That's an incredible difference, right?
Yeah.
Yeah.
And if you just take an idea like a school breakfast program.
Yeah.
How many of those are because parents have problem with alcohol use and so are not able either to hold their job or to get up to make the breakfast, or like there's just so many examples of where this ripple can go through. An interesting one is with the judicial system. They can't recommend like different how it works, but like they can't enforce a treatment option of sorts, but they can recommend. And so far the judges that we've been speaking to are really receptive to the idea of a treatment option, because just like with providers, with people, it all comes down to hope, right?
Comes down to hope. Yeah.
There was nothing that could be done that seemed to be working for people for whatever your sector you're in. And now there is.
Right.
Some people are a little hesitant, like it's too good to be true, but really bringing that hope back. Yeah.
For sure. We'll probably close out in a minute or two here, but just give us a bit of a summary of Dr. Harry's. Didn't tell the full story.
Yes. Well, I think we left it off where he went and did a provincial conference and kind of looked around the room and was like, oh, people, what I assume might have already known, don't. So he came back to Penticton with a mission. He was going to talk to everybody and anybody who would listen, and he was going to get this information out there. Even though he has 9 kids. Yeah.
9
and then he was diagnosed with ALS, which is a really horrible terminal illness, which really starts to degrade all of your muscle action. So ability to walk, talk, chew, all like it's Lou Gehrig's disease. It's not pleasant. Even though he had that illness of his own to deal with, he just kept going and just kept spreading his message, presenting to thousands of people, judges, corrections workers, mental health, substance use workers. And he made a video, and through there, people were just talking, hey, you should make this into society. And then after his diagnosis, we're like, yeah, we really should do something to carry on his legacy. And it started off with the BC AUD Society. And then like before we'd even registered the domain name, it's like, how about the Canadian? Like, I don't think people in BC should just know about this, should be Canadian. Right. Like, okay, yes, Jeff. Yep. And then I think he was already talking international too, but
right.
Yeah, we didn't quite get there. But he was the hope, compassion, knowledge piece of it, and that's like been our model since then. People have said like, why, like, how do you start a little organization here in Penticton and think it's going to go national? And for him, he was always a why not?
Yeah,
just
it's got to start somewhere.
Start somewhere.
Yeah,
keep going. Yeah.
Yeah, I feel blessed to have known him for a year before he passed away. And, he's very inspiring.
Yeah, and he had a special presence and way of speaking with people. He really understood that you have to converse with people and meet them where they're at.
Yeah.
Always interested in everybody's story. We're trying to emulate all that as we're trying to help shift minds.
Yeah.
Yeah.
Yeah, it makes sense for sure.
Mm-hmm.
Well, you and everyone else at CAUDS have done an excellent job of continuing that legacy. It's really inspiring to see. So we're very grateful as a foundation to be involved, and we'll continue to stay involved in any way that we can. But before we close, can you tell people where they can find out more about?
Yes, for sure. You can visit our website. It's at www.cauds.org, and CAUDS is CAUDS. We have all kinds of resources there for right up through the whole care journey, whether you're wondering what alcohol use disorder is, right through to what happens after you come home with a treatment option. We have stories, we have videos.
Testimonials, like people that have...
Yeah, we have stories, and we have a place where you can contact us and ask us questions. So just have a look at the website, and if you don't find what you're looking for, you can email, and I'll be the one who answers you.
You have a great documentary also, which
yes, we do. Yeah,
was premiered here in Penticton.
Yeah.
What's happening next with that?
Yeah, so that's called Smashed. It's a half-an-hour film which local filmmakers here made through this Tell a Story Hive grant, and it's won several awards. And we've screened it twice here in Penticton. And what we do is we pair it with a question and answer with a local physician or physicians to really have conversations with people, and they can ask questions and things. And so that was so successful that we are offering it to other communities. If they would like to watch that, we can try and set something up. So we have a question and answer period as well.
Awesome.
Yeah.
Well, anything I've forgotten to bring up?
No, I don't think so. I think just reiterate the message that alcohol use disorder is a medical condition. There's treatment options available, which really help curb cravings, which then helps people put their health care in their own hands so they can make choices about how they want to live their life. They don't have to stop drinking altogether. You can just reduce. Now the guidelines say that we should reduce quite a bit to 2 drinks a week.
I don't know about that.
I get it. There's research going about treatment options, alcohol use disorder, also about how alcohol really affects a lot of different parts of your body.
It is bad for us.
Yeah, and it's not.
There's nothing good about it.
Well,
except the social side.
Yeah, exactly. So anyway, if you stick to 2 or less a week, then your risks of different types of cancers and things are minimal.
Yeah.
But really, the message is there's hope. You can find a way to manage your cravings, get your health care, get your life back in your hands, and you can make the choices that you want and reconnect.
Well, that's great. congrats on all the success so far, and we can't wait to see what happens next.
Yeah,
Thanks for
so
joining us today.
thank you very
Yeah.
much.